Chapter 1, Cellular and Molecular Biology of Aqueous Hemodynamics, from Shields' Textbook of Glaucoma, 6th edition, page number 18. Molecular Mechanisms of Aqueous Humor Outflow Resistance. The biomechanical parameters and fluid hydrodynamics of the aqueous humor outflow pathways are complex. The technical challenges to study this important scientific discipline include the unique anatomy of these ocular tissues, the minute amounts of tissue available for study, and the difficulties in studying these tissues in vivo. Resistance in the trabecular meshwork. Although the precise mechanism of resistance to conventional outflow is unknown, the following observations provide evidence that most resistance to conventional outflow or trabecular outflow is thought to be a combination of the inner wall endothelial layer and the adjacent juxtacanaliculated tissues. Perfusion studies. Grant demonstrated that a 360-degree incision of the trabecular meshwork, trabeculotomy, eliminates approximately 75% of the normal outflow resistance. However, when such an eye is perfused at 7 mm of mercury, the trabeculotomy eliminates only half the measured aqueous flow resistance. The remainder of the resistance to conventional aqueous humor outflow appears to be within the intracellular outflow channels. One study in monkeys has suggested that 60% to 65% of outflow resistance is in the trabecular meshwork. 25% is in the inner one-third to one-half of the sclera, and 15% is in the outer one-half to one-third of the sclera. Elevating intraocular pressure causes an increased resistance to aqueous humor outflow, which appears to be related to a collapse of Schlemm's canal due to distension of the trabecular meshwork and increase in endothelial vacuoles with ballooning of the inner wall endothelial cells into the canal. As might be expected from these observations, resistance to outflow is decreased by expanding the Schlemm canal. The trabecular meshwork has been described as a three-dimensional set of diagonally crossing collagen fibers, which respond to backward-inward displacement with the widening of the Schlemm canal, with either posterior depression of the lens or tension on the choroid. The tension on the trabecular meshwork caused an increased outflow facility, which appeared to be due to widening of the Schlemm canal and an increase in canal inner wall porosity. Further evidence for the effect of expanding the Schlemm canal may be supported by the IOP-lowering effect of viscocanalostomy. In contrast, after successful filtration surgery, there is a decrease in the size of the Schlemm canal, most likely due to underperfusion of the meshwork. The pattern of aqueous humor circulation within the Schlemm canal is not fully understood. Perfusion studies in enucleated human adult eyes suggest that aqueous humor cannot flow more than 10 degrees within the canal, although there is less resistance to circumferential flow in infant eyes. However, studies of segmental blood reflux into the Schlemm canal imply that the canal is normally entirely open and there is a circumferential flow. Other perfusion studies using tracer elements showed relatively free flow through the trabecular spaces and juxtacanalicular connective tissue until reaching the inner surface of the inner wall of endothelium of the Schlemm canal. However, microspheres of smaller size than those used to determine flow dimensions in a perfused eye are captured by sticky wall interactions. This artifact may limit the information gained from perfusion studies concerning the dimensions of the flow limiting passages in the conventional outflow system. Morphology changes. The normal human tubercular meshwork undergoes several changes with age. The general configuration changes from a long wedge shape to a shorter, more rhomboidal form. The scleral spore becomes more prominent. The uveal meshwork becomes more compact, and localized closures in the Schlemm canal are present. The trabecular beams progressively thicken and the endothelial cellularity declines at the rate of approximately 0.58% of the cell per year, occasionally leading to trabecular denuding. A decrease in the number of giant vacuoles and of the cell count in the Schlemm canal is explained by an age-related reduction in the size of the Schlemm canal. In addition to these changes, the intertrabecular spaces narrow and extracellular material increases, especially electron-dense plaques near the juxtacanalicular tissue that is associated with the ciliary muscle tendons inserting on the scleral spur with age. In COAG, that is chronic open-angle glaucoma, there is a marked loss of trabecular meshwork cells, leading to fusion and thickening of trabecular lamellae and a significant increase in electron-dense plaques compared with age-matched controls owing to components of the extracellular matrix that adhere to the sheaths of the elastic fibers and their connections to the inner wall endothelium. In steroid-induced glaucoma, an increase in fine fibrillar material stains for collagen type 4 in the subendothelial region of the Schlemm canal. In pigmentary glaucoma, cell loss is more prominent than in eyes with COAG, presumably due to overload with pigment granules that were visible in remaining trabecular meshwork cells. The denuded trabecular meshwork areas were collapsed and there were areas of disorganized cribriform regions and collapse of the Schlemm canal. These occluded areas had no pigment granules. The extracellular matrix. The extracellular matrix within basement membranes and stroma of the tubercular meshwork plays an important mechanism for regulating intraocular pressure. The extracellular matrix is composed of fibrillar and non-fibrillar collagens, elastin containing microfibrils, matricellular and structural organizing proteins, glycosaminoglycans, and proteoglycans. The extracellular matrix of the outflow pathway is dynamic, undergoing constant turnover and remodeling in response to mechanically induced IOP stretching through cell adhesion proteins, cell surface receptors, associated binding proteins, certain cytokines, growth factors, and drugs. The glycosaminoglycans have been extensively studied as a component of the extracellular matrix in the tubercular meshwork. Recently, in an organ culture perfusion study, outflow facility was increased at least threefold in porcine eyes and 1.5-fold in human eyes by restricting glycosaminoglycan biosynthesis with chlorate, an inhibitor of sulfation, and with beta xyloxide, which provides a competitive nucleation point for addition of disaccharide units. In the control eyes, immunostaining for chondroitin and heparin sulfates was intensely staining the juxtacanalicular tissue region. In treated eyes, staining was severely reduced and showed prominent plaques. Overall, in the tubercular meshwork and endothelium of the Schlemm canal, fibrinolysis is favored as a protective mechanism against obstruction from fibrin and platelets. In addition to facilitating the resolution of fibrin clots, tissue plasminogen activator may also influence resistance to aqueous humor outflow under normal circumstances by altering the glycoprotein content of the extracellular matrix. Glucocorticoid mechanisms. The effects of glucocorticoids in the tubercular outflow pathway are complex, with both physiologic and pharmacologic implications. Glucocorticoids inhibit the synthesis of endogenous prostaglandins, which is clinically relevant because certain prostaglandins increase intraocular pressure in high doses, but reduce ocular tension in moderate to low concentration. Glucocorticoid receptors have been demonstrated in trabeculectomy specimens from human glucomatous eyes, non-glucomatous autopsy eyes, and cultured human trabecular cells. Glucocorticoids may influence the outflow facility by a direct effect on the extracellular matrix metabolism and the cytoskeleton. The role of myosin, previously called TIGR expression, in the trabecular outflow pathways is not fully understood, but it is clinically important given its role in juvenile glaucoma. Some studies have shown that myosin expression is increased in trabecular meshwork in response to dexamethasone. But it is curious that patients who have steroid-induced glaucoma do not have myosin mutations. Previously, we have seen a point regarding myosin, that myosin has been detected in normal aqueous humor, but it is absent in the aqueous humor of patients with myosin-associated glaucoma. It is present in normal aqueous humor and it is absent in the aqueous humor of patients with myosin-associated glaucoma. Now, cellular and cytoskeletal mechanisms. The trabecular endothelial cells have been shown to phagocytosis. Now, the cellular and cytoskeletal mechanisms. The trabecular endothelial cells have been shown to phagocytize and degrade foreign material, to phagocytize pigment granules observed in eyes with pigmentary glaucoma, and to engulf debris detached from the trabecular core and live in the Schlemm canal. A general mechanism that contributes to decreased function of trabecular meshwork cells is progressive accumulation of damaged proteins with age due to oxidative stress and to a decline in the cellular proteolytic machinery that eliminates misfolded and damaged proteins. Altering trabecular meshwork resistance to the cytoskeleton has been shown in different experimental models. In a perfusion model with substances that are known to disrupt the microfilaments such as cytochlasins, EDTA, or H7, monkey eyes show significantly reduced resistance to aqueous humor outflow, and histology showed alterations in the trabecular meshwork or inner wall of Schlemm canal. In a perfusion model with sulfhydryl reagents including iodoacetamide, N-ethylmalimide, and ethacrylic acid, facility of outflow increased owing to an alteration of cell membrane sulfhydryl groups at multiple sites in the endothelial lining of the Schlemm canal, and it is not due to a metabolic inhibition. Another mechanism by which sulfhydryl groups might modulate aqueous humor outflow involves hydrogen peroxide, a normal constituent of aqueous humor, which may reduce outflows to oxidative damage of the trabecular meshwork. Calf trabecular meshwork contains the sulfhydryl compound glutathione as well as the enzyme glutathione peroxidase, which catalyzes the reaction between glutathione and hydrogen peroxide, thereby detoxifying the latter and presumably protecting the meshwork from its harmful effects. In the pig eye, oxidative damage increases outflow facility at normal pressure but decreases it with elevated IOP, suggesting that elevated pressure may increase susceptibility of the outflow pathway to this form of stress. Resistance to unconventional outflow. Our understanding of the unconventional outflow system is based more on physiology than on anatomy, and further study is needed to correlate function and anatomy in this system. In general terms, the uveoscleral pathway is characterized as pressure independent, is reduced by cholinergic agonists, chapter 32, decreases with aging, and is enhanced by prostaglandin drugs. In both humans and monkeys, there is a decline in uveoscleral outflow with aging. A potential explanation for the observed decline in uveoscleral outflow with aging is thickening of elastic fibers in the ciliary muscles. Episcleral venous pressure. As discussed earlier in this chapter, Another factor that contributes to the intraocular pressure is episcleral venous pressure. The precise interrelationship between episcleral venous pressure and aqueous hemodynamics is complex and is only partially understood. It has been commonly thought that for each millimeter mercury increase in episcleral venous pressure, the intraocular pressure increases 1 millimeters of mercury, although it may be that the magnitude of intraocular pressure increase is greater than the increase in venous pressure. The normal episcleral venous pressure is reported to be within the range of 8 to 11 millimeters of mercury. However, these values are influenced considerably by the particular technique of measurement, as discussed in Chapter 3. Key points. Our understanding of the embryology of these ocular structures has advanced considerably from studies in human genetics, cellular and molecular biology, and transgenic animals. The basic chemistry of the aqueous humor is known. The multiple functions of this dynamic fluid include maintaining intraocular pressure, providing substrates and removing metabolites from the ocular structures, delivering high concentrations of ascorbic acid, participating in local paracrine signaling and immune responses, and providing a colorless and transparent medium as a part of the eye's optical system. We have considerable knowledge about the morphology of the ciliary body. However, we do not yet fully understand the molecular mechanisms that regulate circadian rhythm, hormonal effects, and aging impact on aqueous humor production. We have considerable knowledge about the morphology of the tubercular and uveoscleral outflow pathways in health and aging. However, we do not yet fully understand the molecular mechanisms that regulate outflow to these pathways. In general, it is thought that the most resistance to outflow is due to a combination of the inner wall, endothelial layer, and adjacent juxtacanalicular tissues. Now, in this video, I have covered the molecular mechanism of aqueous humor outflow resistance and aging process and what happens in chronic open-angle glaucoma at histology level in the trabecular meshwork and aqueous humor outflow pathway. I would like to combine the Wolff's anatomy notes. I would like to combine it with Wolff's anatomy pages regarding the same topic. So the aging and open-angle glaucoma. The aging eye and open-angle glaucoma. We have already discussed it in previous video on Wolff's anatomy aging eye. But this is for just revision. So the aging eye and open-angle glaucoma, what happens at histological level? A number of structural changes are observed in the drainage angle with advancing age that may contribute to the increase in resistance which is encountered in aging eyes. An exaggeration of this process may contribute further to the increased resistance in primary open-angle glaucoma. With aging, the thickness of the tubercular sheets increases 2 to 3-fold, mainly due to an accumulation of curly collagen in the cortical zone and core of the beams as well as basement membrane material. However, the amounts of collagen associated proteoglycans, that is chondroitin and amyloid sulfates, decrease and the peripheral microfibrillar component of elastin becomes obscure. Degenerative changes occur in the trabecular cells and the number of cells is reduced, which results in a depletion of the cellular covering and subsequent fusion of the trabecular beams, a process referred to as hyalinization of the meshwork. The consequent reduction in the open spaces of the meshwork is implicated in the age-related tree direction for the development of increased resistance to aqueous humor outflow and elevated intraocular pressure. Cell loss also occurs in the pericanalicular region together with an accumulation of the 55 nanometer banded component which ensheaths the elastic fibers and other extracellular matrix molecules such as curly collagen and fibronectin. The content of hyaluronic acid in the region of aging eyes is decreased. The content of hyaluronic acid in this region of aging eyes is decreased. Biochemical investigations show an increase in the amount of fibronectin, type 6 collagen, and thrombopoietin, and a decrease in laminin. However, laminin has been shown to accumulate beneath the endothelial lining of Schlimm's canal in aging eyes. Morphologically similar but exaggerated changes are observed in eyes with primary open-angle glaucoma compared to age-matched normal eyes. The amount of curly collagen in the tubercular beams is greatly increased, and there is further reduction in the numbers of tubercular cells. In the pericanalicular region, noteworthy changes include increased amount of fibronectin and elastin, as well as its 55 nanometer sheet component, which has the appearance of granular amorphous material, and decreased amounts of hyaluronic acid. The paucity of giant vacuoles in the endothelial lining of Schlemm canal is usually a significant finding, although some investigators have disputed this. The attenuation of Schlemm's canal may be an early event, while a decrease in the diameter of the collector channels is not apparent early in the disease. Tubercular meshwork of an 80-year-old normotensive human eye in meridional section. The tubercular sheets have thickened cortical zone, which contains abundant curly collagen and basement membrane material. Asterisk denotes lack of tubercular cells between two adjacent sheets. EL stands for elastic tissue associated with banded structures. Transmission electron micrograph, original magnification 20,000 times. Figure 8.30. Tubercular meshwork of an 84-year-old patient with advanced primary open-angle glaucoma. In meridional section, tubercular cells TC show degenerative changes in the thickened cortical zone. CZ contains basement membrane material and curly collagen. EL for elastic tissue. Transmission electron micrography, original magnification is 24,000 times. Figure 8.31. Tubercular meshwork from a patient with advanced glaucoma. In meridional section, the pronounced thickening of the cortical zone CZ of individual sheets, as well as the marked degeneration of the tubercular cells asterisk, has resulted in hyalinization of the meshwork. Transmission electron micrograph, original magnification 19,000 times. Figure 8.32. In survey electron micrograph of Schlemm's canal SC, in an 84-year-old patient with moderately advanced primary open-angle glaucoma, among various changes, there is accumulation of granular amorphous material associated with some banded structures. Note the presence of similar material in the corneoscleral wall CS and hypocellularity of pericanalicular tissue of the tubercular wall TW. The enclosed area is shown at high magnification in figure B. Original magnification is 6250 times. Now B. Beneath the endothelial lining, the presence of basement membrane material BMM, granular amorphous element GA, associated with degenerate elastic tissue banded profiles BS, and degenerate collagen fibrils asterisk is apparent. Original magnification 48,000 times. Figure 8.33. Survey electron micrograph of the tubercular wall of Schlemm's canal SC of an 82-year-old normotensive human eye. In meridional section, the endothelial lining N for cell nuclei is a single layer of cells, many of which contain vacuolar configurations V. OS stands for open extracellular spaces of the pericanalicular region. Original magnification 8750 times. Figure 8.33. B. Survey electron micrograph of the tubercular wall of Schlemm's canal SC in an 84-year-old patient with advanced primary open-angle glaucoma. The endothelial lining is attenuated with the loss of vacuolar structures. Inset shows a markedly attenuated area in the lining of Schlemm's canal and the presence of fenestrations breached by a membranous diaphragm. Original magnification 7000 times, inset 62,000 times. Thank you.